moving on to lymphatics. Now, lymphatics are another accessory part of our circulation. I like to think of them as like a backup to our circulation. They kind of work behind the scenes. And we talked about their function in clearing away the excess fluid that is filtered out into the tissues, that 3 liters a day that we talked about. So it's a system of vessels, nodes, and organs that work together to clear excess fluid from the tissues. The vessels basically return filtrate that makes it out of the capillaries, out into the interstitial space, and they absorb that excess fluid into lymphatic capillaries. So when we're saying that we start at the capillaries here, we're really speaking about lymphatic capillaries. So lymphatic capillaries are different from our standard capillaries in the vasculature. They have large pores, they can take in large molecules, proteins, cells, and lots of fluid, and they drive that fluid from capillaries towards our venous system, okay? So the lymphatic veins drain from the capillaries of our body into lymphatic capillaries and then eventually into lymphatic ducts. We have 2 major ducts that drain our lymph fluid. The thoracic duct drains most of our body, particularly the left side. And then there's also a right lymphatic duct, which drains usually only the head and neck on the right side, so a much smaller area. Now, the thoracic duct will dump all of this lymph fluid from the lymphatic ducts into the right atrium. So it's going to access the venous system at this point. And that's a really nice way to get that excess filtrate that made it out of the capillaries back into the systemic circulation. So lymph is going to move in these veins in the same way that it does through our regular veins. So how is that? How does lymph move in our veins? How does blood move in our veins? What's important for the movement of blood? Pressure gradients, excellent. So the same way that blood moves along our vessels, arteries, and veins is the same way that lymph moves along lymphatic vessels and lymphatic ducts. Now, it's also an important communication with the immune system. So we also have lymph nodes. So lymph nodes are usually present at really strategic locations, typically the axilla, usually in the neck and the groin, and they help to drain that lymphatic fluid, and they basically are scavenging that lymph for any type of bacteria or pathogens, and macrophages are present in the nodes, and they basically engulf or help defend our body against some of those pathogens. This is why if you have an infection in your mouth, or sometimes if you pulled a tooth and it's swollen, you'll see that your submandibular or submental lymph nodes would swell. Or if you have an infection in the upper limbs, you'll see that the axillary nodes will swell. And that's just indicating that the node that's draining that region has indicated some type of immune agitator, right? Bacteria or anything like that. Now this schematic shows the communication of veins, capillaries, and our lymph vessels. So what we can see here is that the pulmonary circulation, the capillaries here communicate with the lymphatic capillaries, and our traditional systemic capillaries communicate with the lymphatic capillaries as well. And we can see the direction of flow. Now, what do you think is important in keeping the direction of flow in one way towards veins? Valves, right, perfect, valves. So just like we saw with the veins, we also have valves in the lymphatic vessels to keep blood flowing in one direction, because this system is also working against gravity, moving along our limbs, which can help prevent that backflow.